So that's all was to it, you know, as far as we're concerned. Okay, now
Today I want to talk to you about an issue that's vital for the safety and well-being of patients, healthcare providers, and our entire healthcare system. And that's the need for safe nurse-to-patient ratios in hospitals and healthcare facilities. Imagine yourself or a loved one in the hospital. You want to know that you're in good hands, that your nurses have the time to care for you, to listen to your concerns, to notice changes in your condition, and to respond quickly in an emergency. Unfortunately, for too many patients, that's not the reality. Nurses across the country are stretched far too thin, sometimes responsible for caring for 6, 8, or even more patients at a time. This isn't just challenging for the nurses, it's dangerous for the patients. Why are safe nurse-to-patient ratios so critical? When nurses have too many patients, they can't provide the level of care every patient deserves. Research has shown that high nurse-to-patient ratios are directly linked to worse patient outcomes, including higher rates of infections, medication errors, and even mortality. In fact, studies have found that for every additional patient assigned to a nurse, the risk of patient death increases by about 7%. That's a powerful statistic, one that makes it clear that nurse staffing is about life and death. But it's not just the patients who are affected. Nurses themselves are suffering from this system. High ratios lead to burnout, stress, and emotional exhaustion. Nurses are asked to provide high-quality, compassionate care, and when they're overworked and overwhelmed, that becomes nearly impossible. Burned out nurses are more likely to leave the profession, which only worsens the situation. This is a vicious cycle that hurts everyone involved. In fact, according to a survey by the American Nurses Association, over half of nurses say they're thinking about leaving the profession in the next few years due to stressful conditions and lack of appropriate support. Imagine what would happen to our healthcare system if we lost even a fraction of those nurses. So what's the solution? The solution is to implement mandatory safe nurse-to-patient ratios. Some places like California have already done this, and the results speak for themselves. In California, nurses are assigned no more than 5 patients at a time in medical surgical units and even fewer in specialty units like intensive care. Since this law was enacted, California has seen better patient outcomes, lower rates of nurse burnout, and higher job satisfaction among nurses. This shows us that safe ratios are not only possible, they work. Why should we all support this change? Whether or not we work in healthcare, we all rely on nurses at some point in our lives. By supporting safe nurse-to-patient ratios, we're supporting a healthcare system that values quality care, that prioritizes patient safety, and that respects the hard work of our nurses. Safe staffing is not just an issue for nurses, it's an issue for all of us. When nurses have manageable workloads, they have the time to monitor each patient closely, catch complications early, and provide the care and attention that patients need to heal. What can you do to help? Write to your lawmakers and ask them to support safe staffing legislation. Raise awareness about the importance of the issue. If you work in healthcare, advocate for safe staffing within your own institution. And if you're a patient or family member of a patient, speak up about the importance of adequate nurse staffing for quality care. Let's stand together to ensure that every patient receives the safe, compassionate care they deserve, and that every nurse has the support and resources to provide it. By prioritizing safe nurse-to-patient ratios, we're making healthcare better for everyone. Thank you.